If you think your Medicare Advantage plan is going to work the same way in 2025, I need you to listen closely because what I'm about to explain is something most seniors won't find out until it directly affects their care. And by the time they notice the cutbacks, it might already be too late to do anything about it. Today, I'm breaking down exactly what services Medicare Advantage plans are quietly reducing, tightening, or removing in 2025, what that means for your coverage, and what steps you can take right now to protect yourself. Stay with me because every detail in this video could save you from surprise bills, denied care, or losing a doctor you've trusted for years. Medicare Advantage companies across the country are facing higher operating costs, stricter government reimbursement rules, and changes in how their plans get paid. And when insurance companies feel the pressure, they rarely cut into their profits. Instead, they adjust benefits, limit access, and shift costs back onto seniors. That's exactly what we're seeing going into 2025. But the truth is, most people won't understand what's changing until after they've already enrolled into the wrong plan. The first big cutback seniors will feel in 2025 involve reduced supplemental benefits. These are the perks that made Medicare Advantage attractive in the first place. Dental, vision, hearing, meals, transportation, fitness memberships, and the long list of extra services commercial plans love to advertise. But next year, more than half of Medicare Advantage insurers are scaling down these extras. Many plans are lowering their dental allowances, removing routine coverage for specific procedures, reducing the number of covered cleanings, and cutting back on crowns and dentures. Vision and hearing benefits, which used to include generous allowances for glasses and hearing aids, are being trimmed to lower amounts, stricter qualification rules, and in some cases, only covering the cheapest devices. Transportation benefits are being tightened too. Plans that used to offer unlimited rides now limit the number of trips per year, or the mileage range, or require pre-approval. And these restrictions usually aren't obvious until a member tries to schedule a ride and is denied. Meals after hospital stays are also being reduced. Fewer plans will offer meal support, and those that still do may lower the number of meals or shorten eligibility windows after a hospital discharge. But that's not the only cutback coming. A major shift in 2025 involves provider networks. More Medicare Advantage plans are shrinking their networks, pushing seniors into narrower choices for specialists and primary care doctors. If you've been seeing the same doctor for years, you may wake up one day to find they're no longer in your network. This creates a ripple effect in care access. When networks shrink, wait times increase. Getting referrals becomes harder, and out-of-network costs can rise dramatically, especially for plans that no longer offer flexible point-of-service options. Many hospitals are also renegotiating or walking away from Medicare Advantage contracts because they feel underpaid or restricted by insurance requirements. When hospitals leave a network, members lose easy access to surgeries, specialists, imaging, and follow-up care. It's happening nationwide, and 2025 will see even more of it. Another area where cutbacks are becoming more noticeable is prior authorizations. Medicare Advantage plans are expected to increase their use of prior authorization requirements next year. That means more approvals needed before you can get imaging, procedures, rehab, outpatient surgeries, home health, durable medical equipment, and even medications. This increases delays, adds frustration, and in some cases leads to outright denials. The problem is that many seniors assume Medicare Advantage works like original Medicare. It doesn't. Under original Medicare, prior authorizations are almost never required. Under Medicare Advantage, they're becoming more common every year. And there's another change few people talk about. More Medicare Advantage plans are increasing copays for specialist visits, physical therapy, diagnostic imaging, and out-of-pocket maximums. These changes don't sound dramatic at first, but when you add them up over the course of a year, they can turn a supposedly low-cost plan into a financial burden. Even plans that advertise $0 premiums may end up shifting more costs to members through higher copays or reduced benefits. Prescription drug coverage inside many Medicare Advantage plans is another area where seniors will feel the squeeze. Some plans are restructuring their formularies, moving medications to higher cost tiers, requiring step therapy, or limiting which pharmacies you can use without paying more. In 2025, many plans are expected to increase prices on brand name drugs and reduce coverage for certain specialty medications. That means higher monthly costs for people managing chronic conditions like heart disease, COPD, cancer, diabetes, or autoimmune disorders. Home health services are also being reshaped. Plans are expected to become stricter about approving home health visits, skilled nursing, and rehabilitation services. If you rely on home nursing or home therapy after a hospital stay, it's important to know your plan may require more documentation, more follow-ups, or shorter coverage windows. Some plans are reducing the number of days they'll cover in skilled nursing facilities before members must start paying out of pocket. This is a major concern for many seniors who assume Medicare Advantage covers everything the same way Medicare Part A does. But Advantage plans aren't required to match original Medicare's exact structure. They can change coverage levels as long as they meet federal minimum standards, and those minimums don't always reflect what members expect. Telehealth benefits are also being adjusted. While many plans expanded telehealth during the pandemic, several insurers are now scaling back these services. Some will limit the types of appointments that qualify for telehealth coverage. Others will raise copays or tie telehealth access to specific in-network providers. Seniors living in rural areas or seniors with transportation challenges may feel these changes the most. Chronic care management is another category where subtle cutbacks are happening. Programs that once provided proactive monitoring, lifestyle support, and regular check-ins are being consolidated or transferred to automated systems. Human support is being replaced with digital tools, text reminders, or app-based instructions. For many older adults, this shift may reduce the quality of their long-term condition management. Now, before we go deeper, this is the perfect moment to pause for a quick reminder. If you want more videos that break down complex Medicare changes in a simple, trustworthy, and clear way, make sure you subscribe to Medicare Mentor. I create these videos so you can protect your health, your wallet, and your peace of mind. And if you're already subscribed, thank you for supporting this channel. Let's continue because there's a lot more seniors need to know. One of the most troubling trends for 2025 is the quiet reduction in out-of-network emergency coverage for certain plans. Emergency room visits are still covered, but some follow-up services at out-of-network hospitals may no longer be protected the way they used to be. This can result in unexpected bills after an emergency, even when the initial visit was fully covered. Some plans are also changing how many inpatient days they'll cover before requiring higher cost sharing. Others are adjusting their rules for observation status versus inpatient status, and this can significantly affect what a member owes after a hospital stay. It's details like these buried deep inside plan documents that catch people off guard. Durable medical equipment coverage is being tightened too. Items like wheelchairs, CPAP machines, oxygen supplies, walkers, and hospital beds may require more approvals or may only be available through a smaller set of contracted suppliers. If the supplier your doctor prefers is no longer in network, you may be forced to switch, even if the equipment quality is lower. In 2025, more Medicare Advantage plans are also cutting back on in-home support services for daily activities. These services were heavily promoted in recent years, offering help with bathing, dressing, light housekeeping, and meal preparation. But many insurers found these programs too costly and too difficult to manage. As a result, they're narrowing eligibility or removing these benefits entirely. Another thing seniors need to be aware of is plan consolidation. Some insurance companies are merging or eliminating certain plan options for 2025. When this happens, members are automatically moved into a different plan. But that new plan might have higher costs, fewer benefits, or a smaller network. Many seniors won't realize their plan changed until January, when their insurance card arrives in the mail, or a doctor tells them their coverage is no longer accepted. This is why reviewing your annual notice of change is so important. That document outlines every change your plan is making, but most people never read it. It's long, confusing, and written in a way that hides the impact of the cutbacks. But the consequences are real. Without noticing it, you could lose a benefit you rely on or end up paying more for a service you always assumed was covered. And here's something many seniors misunderstand. When Medicare Advantage plans cut benefits, they usually don't announce it loudly. They highlight what's new, not what's being reduced. They'll advertise new perks worth a few dollars while quietly scaling back benefits worth hundreds. It's part of the marketing strategy. You need to know exactly what's changing so you can protect yourself and make the smartest enrollment decisions. Staying informed is the best way to avoid being caught off guard. Toward the end of the year, many people start receiving piles of flyers, postcards, and calls encouraging them to switch plans. But what they don't realize is that the biggest changes in 2025 aren't flashy. They're small adjustments layered on top of each other. A lower dental cap here, a higher specialist copay there, a shrink in the provider network, more prior authorizations, reduced transportation, less telehealth, higher drug prices, and when combined, these changes weaken the overall support seniors expect from their Medicare Advantage coverage. But even with these cutbacks, Medicare Advantage can still be the right choice for some people. The key is understanding exactly what you're paying for and comparing it carefully with original Medicare and a Medigap plan. You deserve coverage that fits your health needs,